Hello, everyone, and welcome to MSK Unknown Case Series, case number 40. Here we have ultrasound images of a patient that has medial knee pain, and we have comparison views. So this is right medial knee pain. We have the left knee as a comparison that's within normal limits, and then we have a right ultrasound of the medial aspect of the knee and a patient that has an abnormal finding. And the question that I have for everyone here is, what's the most likely diagnosis on the right side? So again, this is the right side here. This is the left side here. Is this a normal medial collateral ligament, a grade 1 sprain of the medial collateral ligament, a grade 2 sprain of the medial collateral ligament, a grade 3 sprain of the medial collateral ligament, or a medial meniscal tear? What's the most likely diagnosis? And of course, the answer to this is a grade 2 sprain of the MCL. We have a hypoechoic defect along the fibers of the MCL, and I'm going to explain all the findings. And I think it's important, first and foremost, to talk about the anatomy of this on ultrasound. So if we take a look here, this layer, this is the normal left side, and I'm going to focus on the normal left side. If we take a look here, this from here to here superficially, this is a subcutaneous fat. So this layer from, the skin surface to here, this sort of hyperechoic area, this is a subcutaneous fat. And I want to sort of talk about this. This is the meniscus, this triangular hyperechoic structure here. This is the medial meniscus. Now, we often don't evaluate the meniscus on an ultrasound because we can't see the entire extent of the meniscus. So, of course, if there was an anechoic defect in this triangular hyperechoic structure, then we could diagnose a meniscal tear, but we often don't. MRI is certainly much better at diagnosing meniscal tears than ultrasonography. So, but this triangular hyperechoic focus here is the medial meniscus. This structure, this hyperechoic structure here with posterior acoustic shadowing is, of course, the cortex, right? The bony cortex here. This here is, of course, the femur. Then we have the meniscus, and this, of course, is the tibia. So this is the tibial cortex here. This bright line is the cortex, okay? And then this structure, which is what we're actually interested in, this hyperechoic fibrillar structure here that's compact in echo texture, this is the medial collateral ligament. This is the medial collateral ligament runs just superficial to the cortex and is deep to the subcutaneous fat. So this whole layer here, which is totally normal, is the medial collateral ligament, right? And you can see that it's going past the meniscus and it's going, inserts 5 to 7 centimeters below the joint line along the proximal tibia, right? So, but if we take a look here, we can see this, MCL or medial collateral ligament, but there's this, oblique or angular hypoechoic or anechoic defect. It doesn't involve the entire thickness of the medial collateral ligament, but involves much of it. So it's a partial tear, and this suggests a grade 2 sprain of the medial collateral ligament, right? A grade 2 sprain is a partial tear of the medial collateral ligament. And, just like we can make this finding on an MRI, we can certainly make this finding on an ultrasound exam as well, for patients that have knee pain, medial knee pain. Sometimes they may not tolerate an MRI because of claustrophobia, or they have some sort of pacer or whatever it is that they can't do it, some sort of contraindication. An ultrasound would be just as good as an MRI in diagnosing an MCL sprain. So this is a nice example of what a partial MCL tear would look like. Now, MCL sprains, they're equivalent to MRI. And the findings are pretty much the exact same. So all the findings that you know about an MRI apply essentially to an ultrasound, right? So a grade 1 sprain is when you just have thickening or periligamentous edema around the MCL. The fibers themselves are going to be totally intact, but we just see thickening or periligamentous edema of the MCL. A grade 2 is what you just saw, right? A partial tear of the MCL. There's partial discontinuity of the hyperechoic fibrillar fibers on ultrasound. Some of the fibers are still intact, as you just saw, but there is a hypoechoic or an anechoic defect that maybe involves part of the thickness of the medial collateral ligament. And of course, a grade 3, just like on an MRI, is when you have a complete tear of the MCL. So on ultrasound, this would translate as an anechoic defect involving the full thickness of the fibers of the MCL. And again, we don't typically diagnose meniscal tears. That was a distractor in this question. We typically rely on an MRI to see the extent of the entire meniscus. Okay, so a nice review of what MCL sprains look like and how this can be applied to ultrasonography, which is just as good at diagnosing MCL sprains, whether grade 1, grade 2, or grade 3 as MRI. Thank you so much for your attention. Tune in next week for another high yield MSK unknown case.